The Kintampo Health Research Centre was established in 1994 to conduct high-quality research to shape local and international health policy, programs and practices. The centre says its establishment has chalked many successes.
About 10-15 years ago, we used to take a drug called chloroquine. Now nobody even hears about chloroquine anymore because it wasn't working, and we demonstrated that it was not working, and we went further to look into other antimalarials that could be of benefit to treat malaria. We have contributed in several other ways in terms of capacity building, and I can say, and I'm excited about the fact that we have used our institution to train over 1,300 laboratory scientists and assistants and who are scattered all over the country.
Parents are being admonished to ensure their children take the malaria vaccine, which the centre contributed to its development.
The vaccine is 4 doses. So children will receive it when they are 6 months old, 7 months, 9 months, and the last one will receive when the child is 2 years old. So we encourage mothers to, as usual, they go for their weighing on a monthly basis. They should continue to attend weighing, where the nurses will examine them and give them all the appropriate vaccines, including the malaria vaccine.
The centre is currently researching into hypertension and maternal health.
We screened about 3,000 participants and realized that about 20% of them were having hypertension. But what was worrying was that out of those who were having hypertension, only half of them knew they had hypertension. The rest of them didn't know. And for those who knew, only 20% of them were receiving care as they are supposed to do at the health service setting.
So we are currently undertaking a study on maternal health. And our aim is to find out, and to document pregnant women who we follow up, to find out if there's any adverse outcomes from pregnancy to childbirth to 1 year after delivery. And our aim is to document what I talked about earlier, to find out, what women go through when they are pregnant, so that if there's any adverse outcomes, if there's anything that is causing maternal mortality, if there's anything that is causing neonatal mortality, that's the newborn after delivery, then we want to document it and find out what the actual cause is.
However, despite these successes chalked by the centre over the years, there are some challenges confronting the centre. The director of the centre, Dr. POKU ASANTE, is calling for more support for the facility.
Finances is key. Research cannot be done without finances, and we've been supported by the Ghana government in terms of personnel, the office space and others. But we also request for additional funding for research programs itself. We have been faced by COVID-19. We got support from the Ministry of Health, but research goes way beyond that. The health problems that we currently face are more than the funds that are available, and so our support has come from external funding from the WHO for the work that we do. So we have appealed to corporate bodies and individuals, and we're getting some responses, but not as much.
The authorities at the Kintampo Health Research Centre are calling on government, corporate bodies and individuals to support their research findings to help improve health delivery in the country. From the Kintampo Health Research Centre, I am Michael Saponifum for Citi News.